Over the past year or so, you've probably heard a lot about superfoods. What are they? What makes them so super? Dr. Milady Murphy's here from Shelton State's Health and Wellness Center to tell us more. Dr. Murphy, it's good to see you again.
Always good to see you, Daniel. You know, the National Institute of Health has helped to define that word superfood. They have created a chart that defines food's antioxidant capacity. And they have rated blueberries one of the most powerful superfoods that go along with that chart.
So when we're talking about superfoods, blueberries are the most super of the foods? Is that what you're saying?
Out of the fruits.
Gotcha, okay.
And the name of the chart by the National Institute of Health, and I wrote it down because I wanted to be very clear. It's called ORAC, and the acronym stands for Oxygen Radical Absorption Capacity. And what that means is scientists designed this chart rating foods on their ability to negate free radicals. Now, everybody's heard about free radicals. They're what we release in our body when we're exposed to pollution, poor lifestyle habits, you know, like smoking and fried foods that we ingest. And we release what is called free radicals. These are cancer-causing accelerators. And so what the National Institute of Health has done very well through scientific research, they have categorized foods that have high antioxidant capacities that negate free radical development that causes cancer. But what we've also found why they're called superfoods is not that they only fight one disease, they fight many diseases. Blueberries are in that category of superfoods, rated very highly by the National Institute of Health. What they find out with blueberries is it now enhances memory.
Really?
In its nutrient capacity. And it may decrease dementia.
Really?
And it will enhance cognitive development. They did a very in-depth study with the senior population, one case that showed that those individuals that had blueberries as compared to those that didn't had better recall and better cognitive capacity than those seniors that didn't. We also now know that blueberries lower the bad cholesterol. They regulate blood sugar. They have a low glycemic effect, so it doesn't contribute to type 2 diabetes. So we're finding the foods that are functional in disease prevention properties in the categories called superfoods. But the National Institute of Health has come with a way of helping us discern what foods are the most powerful in helping to fight certain diseases like cancer and other diseases that we just mentioned.
Now, how often do we want to eat blueberries? Do we want to eat them every day, every meal?
Excellent question. What the study showed is 2 cups a day is powerful enough to warrant off many of the diseases that happen with the aging process, like heart disease, certain cancers, diabetes. And because it has a low glycemic effect and it regulates blood sugar, it even helps us to control